Welcome to the Veterans Impact Show, where our commitment is to help, hope, and healing of our veteran family and our nation. I'm Jim Blythe, a U.S. Navy veteran and a certified senior advisor. Join us as we continue the mission of leadership and commitment to our communities and our great country. Why, you never know where we're going to go or who you're going to meet. We invite you to join in, plug in, and share in what we do. This is your Veterans Impact Show. Hey, I'm Jim Blythe, U.S. Navy veteran, Vietnam, and Cedric White, U.S. Navy veteran. Man, I got to tell you, you got to fire the big missiles, and I got to watch the airplanes take off.
We take care of the U.S. Right?
We did,
right.
And we did. And we always say a special prayer for our deployed active duty military right now. We got a lot of them. We are all about help, hope, and healing. That's who we are. That's what we do. And so today we've got an exceptional program brought to me by a very good friend of mine, Dr. Kyle Knapp. We're going to be talking about a fantastic symposium that's going on in Dallas and what they're doing. So let me introduce Dr. Kyle Knapp, chiropractor. Welcome aboard, Kyle.
Thank you so much for having me, Jim. It's an honor to bring up some information that would benefit your listeners and also the veterans, looking for other healthcare treatments. Thank you so much for having me.
Introduce Joseph Krieger. Joseph, I'm looking forward to having you tell us all about Boston BioLife, and thank you for being on board.
Well, thank you for having me. It's always wonderful to be able to communicate with folks like yourself, trying to help others, and this is a part of my life that's very important, and so I'm really grateful to be here.
Hey, we're thrilled to have you. Now, Kyle, you are a U.S. Army veteran. Tell us a little bit about that service. But what motivated you to become a doctor of chiropractic? What moved you that direction?
Yeah, thanks so much for having me. Well, first off, so I was Army, and like the Navy gentlemen that are attendants and the hosts, I didn't do anything medical at all. I started out, in the 75th Ranger Regiment. Got hurt early on, and then I ended up serving as in 10th Mountain Division, which I was deployed multiple times. Several things that sort of got me in this, like a lot of the veterans and attendants, in the military, is some of the best and the worst times that we go through. And, for me, it was, been a spine injury that sort of set me on a path, to become go to be a doctor in chiropractic and also to receive advanced education in something called chiropractic biophysics, which is really the ultimate assessment of spinal ligament injuries and reshaping the spinal curves. And, while I was going through that process, I also had a lot of exposure to environmental toxins and traumatic situations. And so I became really deeply involved in really to better understand the effects of environmental poisons. And, because having been deployed, been in areas where there's burn pits and other areas, I had several conditions that weren't really explained by normal healthcare situations. And that's sort of what led me into functional medicine and eventually into meeting and becoming close friends with Joseph Krieger, who's also one of the leaders in the nation for educating doctors these what's called translational medicines in both functional health, functional medicine, regenerative medicine, and then of course with psychedelic research and studies to bring that information directly into healthcare doctors. They do have an upcoming event that really needs to make sure the listeners are aware of, May 15th and 17th there in Dallas. It's an honor to be able to bring my knowledge and pain, to make it, have it where it's really going to help some other listeners to go through there.
Excuse me, Joe, tell us a little bit about this event, please, and about Boston BioLife. What do you guys do? Where's your place in the medical field?
I appreciate that. So this is actually kind of a culmination of a lot of things. It's the last 10 years of my life in a lot of ways. So I am a biochemist, and I've been in the medical field for 30 years. I was fortunate enough to work with a bunch of engineers, and I became the marketing person for a neurosurgical company that was 50 years old. And what I realized was that the surgical field needed training, very specific training, in order to learn how to implement some of the products that the company sold, radio frequency generators for creating lesions in neurosurgical areas like spine and brain and cardiology and in other areas of the body. So I became an expert in surgical training, and I did that for 15 some odd years. And then I kind of migrated into the life science space and became kind of interested in drug discovery and translational medicine, but from a biological standpoint. So we know what pharma is, and we know pharma has done a lot of wonderful things for patients, and traditional medicine has. But I always felt there was more coming out of labs. I would read and hear stories about, like technologies that could destroy tumors before you got cancer, and early detection methods, and the ability to modulate the immune system to help fight diseases. And so I really started focusing on how do I get that information that's happening in labs and academic research to the healthcare community so that they can, begin to implement some of this for their patients. And that led Boston BioLife on this journey of creating translational medicine courses. And for the last 10 years, we've run programs in regenerative medicine, cosmetics, aesthetics, functional medicine. Beauty is an interesting component, but beauty brings more people to the health arena than pretty much anything else. And it's something that people voluntarily pay for. So it may seem like an odd correlation, versus if you had to go see Kyle, you went there because your back went out or you had some physical problem. Beauty is something that people tend to want to try to buy. And so the cosmetic surgeons realized that if they can start doing functional medicine, they can trick, if you will, some of these patients into being healthier, learning how to exercise and eat better, and things like sleep and meditation. And, a lot of the situations that are helpful are simple, but we know we live in a complex world. So it's really been about bridging the gap between what's possible in academic research and educating healthcare providers so they can actually respond to their patients' needs. And subsequently, post-COVID, there's been a huge demand of healthcare providers by the community directly because of things like biohacking, where people are asking, well, what's red light and what are peptides, and should I get hormone replacement therapy? What energy modalities might help me, avoid things like Parkinson's or Alzheimer's? And the whole gambit of health and wellness has become more scientific, more personalized, and really more specific and energized than I think any other time in healthcare. And there's really amazing opportunities. So what we're trying to do is put scientists, technology providers, healthcare providers, and others, anyone that has a shareholder or stakeholder in a rationale for people to live better, healthier lives. It's just not how long you live, it's the quality of life and having a sense of purpose. And so our theme is energy, chemistry. It's anatomy, chemistry, energy, and spirituality. Those are the four pillars of the Longevity Summit that I'm running now, which is really a culmination of all these concepts.
Mind, body, and spirit. Does that say it, Pastor?
Yeah, you gave me anatomy, you gave me chemistry, and I got spiritual, but there was one more, Joe. What was
energy? The energy. So it's ACEs: anatomy, chemistry, energy, and soul, and spirituality. Because everybody looks at the spiritual side a little uniquely, but that's pretty much. So energy could be like red light, hyperbaric sound, meditation. Chemistry can be like peptides and hormones and exosomes and PRP. And that we know the soul part, and the anatomy is, the face or the body or the organs specific. But really, if we break it into those four areas, you find a litany of solutions, both diagnostic and therapeutic, that people can apply in their everyday lives. They know if they feel better, they have more energy, they have more hope. And the chemistry is so important because we know with meditation and mindfulness, we can shift your neurotransmitters, your brain waves. And there's all these tools that help us think more clearly to avoid stress. Stress is probably the most prevalent and dangerous part of our health. And it's something that we're not wired as mammals or animals to deal with the stress that our current environment brings us. We're in fight or flight 24 hours a day, where normally we would only be under certain circumstances. And so I think it's important that people realize, it's not always what you do, it's what you don't do. And if you're just trying to look better or feel better, or if you're, have some other issue, all of these things can help. And that's what the important part is giving people access to that information.
I would say, as I listen to you, Joe, We approach it from spirit, soul, and body aspect, and you've covered all of that, right? The anatomy, the chemistry, the energy, the soul, and the spiritual aspect. And a lot of people don't realize that it takes all of that. Wouldn't it be wonderful if we could just change our mind and physically feel good? But sometimes it takes some physical things that have to happen, some spiritual things have to happen, and you're covering all of that. I did want to ask a question though, and this one, Dr. Kyle and Joe, can you help me differentiate from the translational to the regenerative to even the psychedelic? You know, coming from traditional and going through all four of those. Can you help me to understand, for those of us who are not that medically inclined, knowledgeably, can you help us to understand the differences?
Kyle, you want to go first?
So yeah, the great question. It does, and I'll tell you, it does sound pretty high level, but the events are a lot of fun to begin with. Not only is the knowledge exciting, it's also putting industry-leading professionals and new therapies into doctors' hands so they can implement these, the very next time, or next workday after that. So translational medicine, the best I approach it, and Joe, let me know, just be specific, is essentially these new emerging therapies and technologies, because there's a slow adoption of new healthcare therapies in modern medicine where we're at, just because the amount of time it takes for doctors to get exposed to it. And also the textbooks aren't really exposing doctors because there's a slow advancement of knowledge, and that's exactly what I believe Boston BioLife's intent is to put those, is to step in front of those translational challenges, to put that information directly into the provider's hands. And it helps with any type of doctor will have use out of it too. So it's really focused on getting the best industry leading professionals with the best, the best technologies into the provider's hands as quickly as possible, because there's ultimately a huge problem is existing in healthcare. I mean, of course, we know about the issue with mental health issues in the United States with the veterans, and at least 22 suicides per day. And of course, we know about all the long-standing chronic injuries that go undiagnosed, and so utilizing those approaches really helps. Does that? You have anything else to add, Joe?
Yeah, well, I mean,
if I can ask, isn't one of the biggest obstacles within the medical field the insurance companies? Because if they don't pay, then a lot of people can't afford to play. Is this also helping to educate the insurance companies on how some of these emerging technologies can actually save the company money by bringing people back to health?
That's sort of a loaded question there. Insurance companies, and I'm a healthcare provider for multiple healthcare insurance companies, as well as a Tri-West community provider. I can't really speak a lot for the major medical insurances like Aetna, Blue Cross, Blue Shield, Cigna, United Healthcare. But I know for a fact, Tri-West, as I'm also a disabled veteran, when I use healthcare through Tri-West and the VA, they really are starting to allow certain kinds of treatments because of the new advancements in legislation. So one of the things here in Texas is that they're in June 11th of 2025, Texas Senate Bill 2308 advanced and provided matched funding for ibogaine treatment, which is one of the different new emerging therapies for addiction, PTSD, anxiety, of which there's quite a bit of resources. And of course, in April 18th of this year, the POTUS president, actually signed an executive order to accelerate medical treatments on mental health, serious mental health illnesses that encompasses ibogaine and other things. So the legislation is leading the charge, not necessarily the insurance companies, to make change, is my perspective.
I'm glad you said that. I think as we progress through this program, I'd like to get down and define more. One of the things you were talking about, things like use the word peptides. What are peptides? A lot of veterans, you said to me, what is peptide? My son was telling me, hey, Dad, you need to get some peptides for your knee. What are peptides? How do they work? Let's define some of these.
So peptides are, if it's my turn, peptides are small chain amino acids. Amino acids are pieces of proteins. Proteins are made of amino acids, and the way biology works is DNA goes to RNA, RNA goes to proteins. You're either made of proteins or you live as a result of the action of proteins. So proteomics is the study of protein biology, and proteins are the first things that start to fall away as we age. So if you looked at the protein profile of a young person and then compared that to an old person, you'll see many, many, many proteins missing as we age. And these proteins are responsible for managing inflammation in our immune system and cellular repair. And so as we get older, we lose these. So peptides are really a simple way to exogenously from the outside replace and replenish pieces of biologically active proteins that we no longer make. And so it gives patients the ability to manage their gut health, to manage their inflammatory biomarkers. It reduces cytokines and creates other regenerative processes. But really, peptides are one piece of the puzzle. They're a good one, and they do a lot of things for a lot of people for a lot of different areas, like aesthetics, like cosmetics, like hair, skin, memory. There's a peptide for just about any. But really, the compounding of different, like GLP-1s are peptides for weight loss, right? So if people want to do weight loss treatment or help people with pre-diabetics or type 2 diabetes, then the GLP-1s, you've heard of semaglutide and tirzepatide or Mounjaro and Wegovy and Ozempic. Those are unique pieces of proteins that the body uses to regulate sugar, and how the body, a lot of things in the body are cyclic, like your mood, like your biorhythms, like your sleep, like your sugar and energy levels. They all kind of move in some, sinusoidal rhythm over time. These GLP-1s are able to stabilize that. So they help with other things like addiction, like compulsion. And a lot of people find that there's other benefits to them other than weight loss. They stay in better mood. They're more cardiovascularly regulated. They're more neurologically regulated. They sleep a little better. There's other types of peptides like ceramorelin and epimorelin, which are growth hormone derivatives. These are things that your body's replacing that you no longer make. And so peptide biology is exciting. There is a regulatory issue afoot where people are trying to figure out, but there's a lot of them that have been, if you followed RFK recently, he just said, let's take these 12 that we don't know about and then put them over here so people can use them. And there's a whole move afoot too for studies.
Let me interrupt you because we're going to have to take a break for just a second to hear from all of our partners. This is an important conversation. Right now, we're defining some of these medical terms and one of these medical things. We were just talking about peptides. There's a lot more that we're going to discuss with Joe Krieger, and we're going to discuss with Dr. Kyle Knapp, chiropractor. It's important that you pay attention. Also, it's important. We're going to put up the website for the Boston BioLife workshop seminar that they're doing right here in Dallas from the 15th to the 17th of May. So stick around, stay with us. This is Jim Blythe and Cedric White. We are your Veterans Impact Show. Welcome back, and thanks to our great sponsors, Fairway Independent Mortgage, Healing Thine Heart's Ministry, and Symbios Integrative Health. Now, let's get back to this conversation.
Listen, welcome back to the Veterans Impact Show. I'm Cedric White, your co-host here with Big Jim Blythe, running things here. But we have a couple of great guests, Dr. Kyle Knapp of Curve Chiropractic, and then Brother Joseph Krieger, who is founder and CEO of Boston BioLife. And they're educating me in a big way in reference to some of the things that are coming out, new ways of treatments when it comes to PTSD, when it comes to traumatic brain injury, and some other things that veterans and others are dealing with. And so before as I was listening to you, Joe, what came to mind is that this isn't, what you're talking about isn't a pharmaceutical rep coming in and talking to a doctor. This training and the seminar that you guys are having is much deeper than just saying, hey, here's another medication. You guys are going to be really giving guys new ways, doctors new ways to help their patients.
Absolutely. And it's really about understanding the patient specifically more so than any individual therapy. What you'll learn over time is that every patient has their own unique set of characteristics. Everybody's their own clinical trial because we're personalized and precision. We're looking at the novel biology. That's why in the pharmaceutical world, you see all these complications, these lawsuits, because they know when they go to make a drug that there's going to be a percentage, 10, 15, 20% of the population not only will not have a positive benefit, they'll have a negative outcome. So they put that money aside. And really it boils down to whether people can metabolize these components in order to use their biologically active material. In this world, what we're trying to say is, what patient does the disease have? So how is this patient expressing from a genetic standpoint, from a metabolomic standpoint, and an environmental standpoint? Keep in mind that your genes are 20% of your biological reality. Your environment is 80%. So if you had identical twins and say they were, Japanese people, and one lived in LA and one lived in Tokyo, they're going to have different outcomes, even though they're genetically the same. And so what we're learning is that if you assess the patient the right way, looking at their biomarkers, looking at their genetics, their sensitivities to certain toxins, molds, environmental things, people don't realize sometimes it's the building that they're in that makes them sick, or it's the jobs that they do or the clothes that they wear. And we're being bombarded epigenetically every day by everything from chemicals to waves to other energy to plastics, et cetera. And honestly, our immune systems are pretty incredible because given all the stuff that we're dealing with, we're still living longer. And for the most part, people can manage their health if they understand a few things. But this conference is really about helping doctors figure out how to assess the patient so they can build the right process, whether it's hormone replacement therapy or a gut microbiome fix or peptides or any type of neurological things like meditation or photobiomodulation or ibogaine, whatever their clinical reality is, understanding its the root cause. You'll hear people talk about that a lot, but it's really true because then you can create a specific solution for just that person. And you'll find others in similar areas, age, ethnicity, clinical types. So veterans with traumatic brain injury, you can almost argue that they're a class of people that can be treated similarly. But really what's happening is there's been so much history around some of these older modalities like hyperbaric, like red light, like ozone, like IV therapies and photobiomodulation. Now they're being revisited and combined. So they know that with certain tests, certain protocols for peptides and hormones and energy modalities, they can reverse some of the symptoms of traumatic brain injury. They have to drop inflammation across the blood-brain barrier. There's new tools for this, and everybody is now more on board than ever about how these legacy tools can be used and how they can be combined in new ways to help our current patient population, which are struggling with things that never really existed before, even over the last 10 years.
So it seems as though whereas before there was a huge delineation, right, between pharmaceutical medication and then even as the laws are being signed or things being signed into law now for psychedelics and so forth and so on, seems to be a more of an acceptance or at least a willingness to look into some of these alternative ways of treating people, right? And then making sure that those who do the treatment are educated.
Yeah, and a lot of times it's the patients that are asking for it. That's putting so much demand on the healthcare provider. So these biohacking groups are running around and they're getting thousands of humans to attend their meetings, and they're talking about sleep and they're talking about microbiome and nutrition and supplements, and they're going and asking their doctors, hey, I heard I should take BPC 157. And the doctor's like, what's that? So they're coming to Boston BioLife, into A4M and others to really learn the basics. And what they realize is there's a lot to know, and then applying it's a whole nother animal. So the good news is there's a lot of solutions, there's a lot of interest, and like you said, there's more acceptance now than ever. And because of the internet or AI or other intelligence tools, we're able to really see the body of work over the decades and years, even hundreds of years, that people have benefit from some of this stuff. A lot of these care providers have lived in the shadows because they're not allowed to say, I can cure cancer with photobiomodulation, because the FDA will shut them down. If they advertise anything like that, they're in trouble. And I'm not saying there aren't people that, perhaps don't respect these things, but there's a lot more value to what we know than we've been able to use in clinical practice. And I think that's what's changing more than anything. Demand and combined.
Joe, you're so right. I was introduced to a class 4 medical laser that's being built here in Dallas. The founder invented it, as well as the vector, which uses neuromodulation using basically neuropuncture. And I have seen amazing things in my own body. I've done it with that.
Myself, right.
I had 2 doctors from Cook County burn unit on several years ago talking about the laser and how they were able to basically do skin grafts and do things that they'd never been able to do before, as well as they cured a diabetic ulcer on a guy's toe, where in the past you get something like that, you're going to end up with an amputation. So all of these new things, but you go back, for instance, Louis Pasteur, when he came out, they mocked him, they threatened him, all that. It always seems like the establishment is refusing to accept, and then all of a sudden, you're getting some fabulous things going. So I tell you what, we're going to be right back after these words from all of our partners. Cedric, you and I are doing great. We're healthy. Let's stay that way. So we're going to be right back from all of these partners' words to help you. So stay with us. Your Veterans Back Show. Welcome back. Thanks to our great sponsors, Fairway Independent Mortgage, Healing Thine Heart Ministry, and Symbiote Integrative Health. Now, let's get back to this conversation.
All right, part 3, back with the Veterans Impact Show. Cedric right here with Jim Blight, and this is Dr. Kyle Knapp and Brother Joseph Krieger of Boston BioLife. There is a training, and can we get
Diane,
more information?
Can you put that website up, please? Yeah. Diane's going to put your website up so that people can see and go to it. Okay, and we want people to know about it because it's really, really important, especially medical professionals. And for a lot of people, Joe, what you and Kyle are talking about, what I have learned about is not only so new, I mean, it's really some of it's been around for a long time, but people are scared to death, scared of cancer, scared of PTSD, scared of Parkinson's, scared of dementia, Alzheimer's. There are modalities, there are procedures, there are things that are changing that game. And that's part of what Boston BioLife, there's the workshop. Can you open that up, Diane?
Oh, yeah.
Okay, well, there's the workshop. So you want to know more about this, go to this website, this spot right there, write it down, go to it. You're going to learn a whole lot. It's an amazing website. I went to it, and they have got some phenomenal speakers. One of the things I'd like to, Joe, Kyle, talk about some of the speakers and topics, please.
Sure. I guess I'll go because Kyle's not 100% familiar with the agenda. But basically, the way that this program works is we start with, like I said before, root cause. We look at the history of aging. What have we tried? What do we know? What have we learned? We look at things like telomeres and senescent cells, and we study inflammation in the gut and how the body's immune system kind of regulates these different processes. But then we get into experts that focus on certain areas like men's health, women's health, and the neuroscience part. But like just in the neuroscience part, we have Duncan Ross, the founder of Chimera Labs, who really is the first person to commercially introduce the term of an exosome. That's a signaling technology that a cell uses to send a message. It's a message in a bottle, if you will, from one cell to another. And it's really the cornerstone of regeneration. So he'll be there. We've got Dane Goodnow, who's doing research and creating products to strengthen the phospholipid membranes of the neurons in the brain. We don't realize that the membrane of the cell, if the integrity of that becomes compromised, which it does as we age, it really facilitates all these other neurological disorders like dementia and Alzheimer's, et cetera. There's people talking about brainwave optimization. There's people looking at hormones. There's people looking at photobiomodulation for neuroentrainment. There's a group using low-frequency ultrasound to open the blood-brain barrier so that IV regenerative medicine therapies like cord blood or exosomes or any type of IV therapy can drop the inflammation across the blood-brain barrier. We have people talking about meditation and mindfulness. And we also have people talking about energy tools such as sound and other consciousness and awareness, because sometimes that's how people can relate psychologically. So it's really the most complex biological science, all the way out to stuff that's pretty easy to understand and implement, like meditation or sound healing or vibrational energies.
Man, that's a mouthful.
Mhm.
And I got to
It's
tell
a
you,
lot.
I am learning. I know, for instance, with neuropuncture, I mean, I bought a machine, I use it. I also have a laser. When I get an injury, when I get something happen, the other thing about, for instance, the neuropuncture that Symbios does,
Mhm.
it increases blood flow and oxygenation. That makes you sleep at night. Every
Yeah.
veteran that I've talked to that have done it, including you, Cedric, start sleeping at night. That makes a huge
Sleep.
difference. One of the things that I've learned, and Kyle, you can comment on this, a lot of times veterans have multiple things going on. It's like peeling an onion. You may not just have an injury, you may also, and you alluded to this, toxic situations. Can you talk about that a little bit? How many veterans have multiple layers of problems?
Absolutely correct. Because a lot of times in the military, as we've discussed earlier, we have a lot of different exposures to different traumas, different traumatic situations and environmental poisons. So a lot of the existing healthcare that's currently being widely used is essentially symptom-based medicine. Where it's doesn't actually identify what the underlying cause is. It identifies a symptom and it treats the symptom rather than the thing that causes the symptom. So a lot of the stuff with environmental poisons, a lot of our listeners may or may not be aware of something known as the PAC Act, which is an expansion of the Agent Orange registry. That for any veteran that had any deployments, certain locations where they had exposure to burn pits on like enclosed bases or FOBs, forward operating bases, where they burn trash on site. There's a significant amount of residue that accumulates in the body, and it produces these unusual symptoms that are manifestations of the body's experience to different kinds of toxins that are into the body. And as Joe earlier said, it's a lot of the microplastics also. And there's a variety of different things that contribute to deterioration of health. While we are living longer, I don't know if we're living as much, because a lot of the symptoms and the different exposures of toxins and traumas, they have a cumulative effect. And it's very hard from the clinical point of view, unless you ultimately embrace the functional medicine approach, where you really dig in to find out what the underlying cause is. And trying to find ways to do treatments on that, is right where Boston BioLife and the Dallas Regenerative Workshop come into play, where it helps providing, the actual tools of diagnostic abilities, new treatments. It goes through a lot of the different aspects of integrating and the challenges to integrate into your practice, clinically speaking. But it's really important to make sure that, the listeners know, it's never really just one thing. It's usually a combination of multiple things that cause, the body to deteriorate, and different kinds of weird, unusual symptoms that modern medicine is like, there's nothing broken. There's no disc herniation, or there's nothing, we're not really looking at digestion. We're not looking at the enteric nervous system or their gut, to see if they have any exposure. So they're sort of left without answers. And there's a slow adoption, with education for providers, especially at the school levels.
That's so important. For instance, you do something amazing as a chiropractic doctor in actually studying what's going on with the back to help people with back problems. Kyle, explain a little bit about that, because you're not just twisting and turning, excuse my explanation, you're really going into some in-depth going on.
Correct. Yeah. So we're a spinal ligament injury center, the only one in the United States. I've had that actually trademarked and registered with the USPTO's office. And then we're also a functional health center. So the ligaments, spinal ligaments, we actually provide the missing diagnostic component, where we actually will, simply put, we'll measure between every bone or vertebra And then we put their body in a state of stress to see if the bone slips. Because most of the time people assume there's things like slip discs. There's actually no such thing as a slip discs. There's slip bones. And that's one of the underlying causes that causes a variety of cascading effects. That'll change the structure of the spinal curves. That'll change the flow of the fluid that is inside the central nervous system called cerebral spinal fluid. And it actually is the most amount of movement between a bone or a vertebra is where degeneration occurs. It's also known as osteoarthritis, which is known as non-inflammatory arthritis. That's caused. We just identify the source and cause of trauma and see where that changes the shape of the structure inside the body, which is the spine. And then we also have patients that have come in with weird, unusual findings where we'll look at heavy metal assessments, heavy metal toxicity using heavy metal testing. We look to rule those things out also, like lead, aluminum, mercury, just name a few of those environmental poisons. But a lot of the times with the treatment, it's really important to make sure that they go to see a whole bunch of different doctors. And usually the doctors, unless they have advanced knowledge and training, they're sort of going to be using the same traumatic-based model where a lot of the diagnostics are done laying down. They're not upright, where you don't see the effects of gravity or stress. And then, of course, the manifestations from environmental poisons and other toxins is very challenging to find out what it does because it causes a cascade of other kinds of injuries and issues. Does that answer your question a little bit, Jim, or do you have anything deeper on that?
You nailed it, Cedric. So there are let's summarize real quick. There are modalities, there are procedures, there are things. You've mentioned exosomes, you've mentioned peptides. I know Dr. Cole here in Dallas, for instance, that uses chelation therapy, which removes heavy metals. That's been around since 1945. And a lot of people don't realize what that can do to help your circulatory system. There's also immune therapy that's an injection. These various, and then we mentioned ibogaine. There are some other psychotropic psychedelics that are being used. Can you elaborate on some of those? Because people want to know.
Yeah, so you talked about the chelation. You want to go, Kyle? Or you want me to go?
Go ahead, Joe.
So when you talk about the chelation, it's really a detox, right? So if you think about it, we got to manage what comes in, and we got to get rid of what's already in there. So if we accumulate toxins, we accumulate things over time, plastics, heavy metals, etc. And our body has our liver and our kidney and our lungs, are filters. But when you have gut dysbiosis, what happens a lot of times is the toxins pour directly into the bloodstream, and the immune system reacts, and they suppress it. So that allows a lot of these long-term things to express themselves. So detox, things like sweating, sauna, fresh air, exercise, chelation therapy. There's things called like C60. There's parts of there's things you can do with your diet and your lifestyle to help remove the toxins that show up every day. And although we are epigenetically bombarded, I think that the fact that people are paying attention to this now is really the most important thing, because people before perhaps didn't really think there was much they could do about it. And now they realize there are things you can do about it. There's things I can do to change the effects of how my immune system reacts. So strengthen the immune system, anything that's detox. You had mentioned sleep. Sleep is the most readily available, easiest to apply, most valuable thing that anybody can do, because that's when your body repairs itself. The other theme that I would make people aware of, that the body is programmed to heal and to regenerate on its own. It's just in the fog of inflammation, which we all live in every day, it doesn't do so very well. So managing inflammatory conditions in the body is probably the most important thing. And of that, I would say managing stress is probably the most important part of that. So it boils down to diet, exercise, lifestyle. And it's not always what you do, it's what you don't do. Like things like Dunkin' Donuts and soda and Starbucks. I mean, there's stuff that you don't have to do.
Wait, Joe. Wait a minute. You're starting to meddle. You move from education to meddle. No, I'm joking.
No, we're kidding. We're messing with you, Joe.
I went to coffee.
A lot of, and there's a lot of time. I mean, Sugar is a poison. Oh,
Sugar.
basically, cancer feeds on sugar.
Sugar,
like
and everything's hidden. They hide sugar in everything.
Yeah.
Sugar is hidden in your flour. It's hidden everywhere. So that's going to
As a child growing up, my mother thought I needed more iron, so she had liver and onions all the time. I loved it, and I love chicken livers. Today, when you find out the toxins that are in livers, because that's what gets it out of the body,
yeah,
you don't want to eat that stuff. I mean, you're eating toxins, but we're drinking toxins. We're eating toxins all day long.
Yeah.
You talk about stress, man alive, just getting on the freeways in Dallas. By the way, Joe, make sure you got a good driver because it gets hairy on LBJ freeway.
I bet it does. Yeah, we'll be Ubering right to the hotel.
And I'm looking forward to introducing you to
Is
Dr.
Joe
Ashley.
coming out of Boston?
Yeah.
Oh, then
Yeah, I'm worried about driving.
You're fine. You're fine. I've driven in Boston before.
It's
Drive
driving.
faster than they
Like driving in India or something.
Oh, no comment. Let's stay focused.
And so this is huge, important. Diane, if you would put up that site again where people can go, I'd appreciate it.
And
Because
I'd like to make an offer. I mean, if anybody wants to come to the conference, there is a fee to come if you're a healthcare provider. There's a list of. I'm willing to put together a promo code VET50, which is a 50% discount for any healthcare provider that wants to attend the workshop. It comes with CME credits. It comes with certificates. There's food. There's 2 receptions. There's going to be 50 technology providers there and some of the best speakers in medicine talking. And I would like to invite all your listeners to come. Now, if you're not a healthcare provider, you're just curious, put my email or make my email available. It's my first name and my last name, Joseph Krieger at Boston BioLife, or simply info@Boston BioLife. And we'll find a way if you want to come to accommodate you. This is the type of thing that really shouldn't be kept from anyone because it has the potential to change lives. You never know what information you'll share and the impact it will have. And that's the hope I think we all have and the reason why we do these things. And so no doubt between Joseph and Krieger. And that's why we're doing this. And so if there's a person that wants to come, an organization, I work with the Healthspan Action Coalition. It's got 170 nonprofits, everything from wheelchair, spinal cord injury, traumatic brain injury, sickle cell anemia, autism. There's a group here for you, and there's a therapy, there's an organization, there's a study, there's something for everyone, whether you have essential tremor or you have joint pain, or you're just not sure what you want to do in order to start on this journey. And I like simple things like nothing works for everybody, nothing works by itself, and nothing works quickly, but there are things you can do. And there's ways to formulate custom solutions for you with your healthcare provider. And honestly, the results are pretty amazing pretty quickly. Fresh air, sunshine, exercise, a sense of purpose, love. The spiritual side of things is so powerful, so important. The brain runs the show. The chemistry of the brain is essential. That's why stress is so bad, because cortisol really just wreaks havoc with all your neurotransmitters. So people think the way they feel anxious, they feel anxiety, they feel depression. Those are real things that can be overcome by shifting the chemistry of the brain. Prayer is so important. The positive, gratitude, faith, divine spirit of action, be of service to others. These are simple principles that anyone can adopt that make a huge difference for all.
Right. Joe, we're going to be back in just a minute. So this is Veterans Impact Show. We're talking about health, hope, health, and healing. Right, Pastor? Yep. Health, hope, and healing. Well, what is it? I get it there. Okay, we'll be right back after these words. This is your Veterans Impact Show.
Welcome back. Thanks to our great sponsors, Fairway Independent Mortgage, Healing Thine Heart's Ministry, and Symbios Integrative Health. Now, let's get back to this conversation.
Well, I got to bring this show back into the dock, but real quick, I've got to say thank you to Fairway Independent Mortgage, my mortgage company. My MLS number is 311-548, and we are an equal opportunity lender. You can go look at fairwaymc.com. We're across the nation. We're here to help veterans. We have American Warrior Initiative. We've given away over $1 million worth of very highly trained service dogs. Also, Symbiosis Integrative Health. They're using vector therapy, they're using neuropuncture, they're using other modalities. Check us out, symbiosisccn.com. And I'm going to have Dr. Ashmore at this conference as well, because she is one of the most brilliant people that I've ever met. It's important that you also know that this program is brought to you by Cedric's Your Healing Thine Heart's Ministry. And I got to tell you, they do so much for marriage counseling, for veterans, active duty military.
Yep, active duty, first responders, full game.
Yeah. And I got to tell you, we've got an initiative going on, Healing Hearts Ministry. It's Healing for Jamaica, Heart for Jamaica. You raise money. Cedric and I have been down there with Diane and Michelle, and they are coming back. That's the most amazing people I've ever seen. Also, I need to say a special thing, because I'm MC. I cannot be at the Boston BioLife thing for very much. I am MCing a deal at the Greenville Airport, Majors Field, that's sponsored by the Commemorative Air Force. There's going to be a fly-in. We've got World War II veterans. We've got World War II aircraft coming in. It's going to be a great deal. And Friday at 5 o'clock, there's going to be a crawfish boil. So if you want to know more about it, Diane's going to post it on our website. It's all about helping out Sea Cadets. It's all about immersing yourself with veterans and people who care for veterans in Greenville, Texas. That's on the 15th and 16th. So it's 5 o'clock on the 15th to meet the pilots, and on the 16th, there's the fly-in. I got to get that one out there. Anything else you got to mention?
I think we're good. We just want to continue providing help, hope, and healing to all of our veterans and our military. We want to be just love to give Dr. Kyle and Joe a last word before we sign off, because what they're doing, this training, this
amazing,
is very important. Very important.
Amazing. Okay, guys, Joe, Kyle.
Go ahead, Kyle.
Yeah, so thank you so much for having us on. It's an honor to work with you guys again. And, I know that you guys are really doing the right thing to try to educate about to the public, to give them the better health opportunities. I'm just honored to be able to be part of a potential solution for educating the doctor to bring these tools in the provider's hands. Just honored to be with you guys again.
Thank you for what you do, Doctor.
Oh, yeah. And Joseph, thank you for what you do. We put up your email. We put up about the workshop. And again, promo code is VET50. We're here for you. One of the things that I think is so important, though, you got resources. You've got resources of doctors who are not only going to go into that, but be participating, that help the community. The medical profession is changing, like everything.
Absolutely.
We're not lost in space. We're part of the space. So you can go to Joseph Krieger and ask him questions. Correct, Joe?
Absolutely. You can go to bostonbiolife.com. So this is a one-off in that we're coming to Dallas. We are traveling around the country every 90 days doing this, and we aren't going to be too far from Dallas because I'm staying in the middle of the country so that both sides can come to the live event. But our live events live in perpetuity on our website under the Boston BioLife Functional Longevity Academy. People are welcome to go there and learn and listen to all the previous talks. And there's a ton of information on the different tools, the companies, the representatives, the scientists that support Boston BioLife, and we're happy to help anyone. So it's not just a single event. This is a longitudinal process and pathway that everybody can be part of. And I'm willing to bet I'll be in Dallas in a year from now as well, doing the same thing, or it'll probably be a little bigger. But I appreciate us having the opportunity to meet with you, because this is where the rubber hits the road, right? So all this stuff's great, but if we can't help anybody, what difference does it make? And it's Boston BioLife's mission and Kyle's mission, and I know it's your mission, to help as many people as we can by sharing knowledge, information, and resources. And that's all we're trying to do.
Joe, I'd like to say, hey, let's see what we can do to put together a deal for veterans and work maybe with the VA. I had Dr. Benjamin Kligler of the VA on talking about integrative health. The VA is moving that direction as well. We want to help. We want to save lives, and we want to stop suicide. I'd also like to mention that Air Power Foundation, go to Air Power Foundation, has a walk to prevent suicide. This is our focus in helping prevent veteran suicide and helping people get healthy. And I thank you guys so much for being on board. I thank you for all you've told us and for what Boston BioLife is doing. Again, go to bostonbiolife.com and find out more about it. Pastor, it's time for us to say that spiritual part of prayer, to say thank you. Can you close us with a prayer?
I can. All right. So, Father, we thank you for this day. We thank you for those who have stepped out into the vineyards and who are working. People like Dr. Knapp and people like Brother Joseph Krieger, who is working in the vineyard to help others from every aspect of life. We thank you for them, and we ask that you continue to give them favor, continue to open doors and opportunities. Father God, continue to help us to provide help, hope, and healing. And for this country, help this country to come back to being one nation under God, indivisible, with liberty and justice for all. This is our prayer in Jesus' name. Amen.
Amen. We thank you for being on board with Veterans Impact Show. We thank you for taking the time to watch our program. Please share it. Please get it out. Please help us help not only our veteran community, but our entire country, because veterans have always led the way. The VA is the biggest healthcare system in the world. Kyle mentioned the PACT Act. You want to know more? All you got to do is get a hold of me. Go to jim@veteransimpactshow.com. Send me a note. I'll help you. So we say thank you. Thank you so much for all you do for us. Thank you for bringing this community back together. Thank you for bringing this nation back together. And if you get the opportunity, be a mentor, be a grandfather, be a father to the fatherless. Thank you. This is Veterans Impact Show.